Okay, folks, welcome to Hump Day Hanger presentation number 15. I know it's hard to believe that it's number 15. In fact, speaking of the 15th, it's the 15th of July, which is tax day this year. So hopefully you got that taken care of. Once again, this presentation is sponsored by supercub.org and the Not So Straight and Level podcast. And I have received so many great notes of thanks for doing these presentations. I appreciate every one of them. The presenters are doing the real work, of course, and your support of them with your kind words and is greatly welcomed. Your support of supercub.org helps make it all possible as well, and I thank you all for that. So don't forget, you can send these YouTube links around to your buddies that missed seeing it the first time, or feel free to share the playlist with them as well too for the Hump Day Hanger presentations. Next week, Steve Pierce is back with an in-depth look at doing an inspection on a Piper Super Cub. I've seen some of the pictures, and you're going to learn all kinds of tricks that apply to almost any airplane. You'll also learn where to look and what to look for. So that's going to be pretty neat. We're always looking for folks to do these presentations. If you have someone you'd suggest, somebody you'd like to see do a presentation here, send me an email and let's talk about it. I don't have a lot backed up for the next few weeks. After that, I've got quite a few folks that are doing, but they weren't able to do it till later in the year. So we're going to keep rolling with these as long as people keep showing up, and we appreciate you being here. So today, with this presentation, towards the end of the presentation, we're going to have probably a longer Q&A period than usual because we expect a lot of questions about medicals and that sort of thing. So if you know how to use the chat box in Zoom, if you're on Zoom, you can use that. If you have a sensitive question you'd like to ask and you trust me, you can use the private message system through chat and private chat me your question, and I will ask Randy that question discreetly as possible. Same with YouTube, although you can't do anything private on there. If you want to ask a question, just put it in the chat on YouTube. So I could spend the better part of an hour telling you stories of what a significant impact Randy Corfman has had on Laura and our lives. I wouldn't even be mentioning the lives of the many supercub.org members who have faced issues or had questions about their medicals that he's helped over the years. His Medical Matter forum on supercub.org remains one of the most popular parts of the site, and Randy's dedication to helping pilots navigate the medical system and stay in the air is unmatched. Welcome, my friend Randy Corfman.
Thank you, Steve. Okay, Steve, what shall I do now?
Okay, well, you should say hello to all the people that are listening.
Okay,
that's where I would start.
I'll start out first by saying hello to all the people that are joining tonight. Steve got down to the bottom of the barrel and had to come up with a gynecologist to talk to you guys. So I brought along something special for you, just so you take this. We try to measure the size of the testicles for their patients who are trying to conceive. And I have here the string of pearls that we use that we can tell the size of the testicles of the guys who are examining in case they have low sperm counts. But for Super Cub guys, they are the size of this. So that's the object lesson for tonight. Now, seriously, the reason that I do flight physicals and the things that go along with it here on supercub.org is to try to keep people flying. And I appreciate it when I go to my AME. I know that he's there on my behalf, and he's not looking for reasons to fail me. He's looking for reasons to make sure that I am still safe medically in the air. And I appreciate that attitude. And when Steve and I talked about doing this several years ago, having Medical Matters, it was just to have a forum with which people could anonymously write in for medical problems that they might be having, that they're not sure how the FAA is going to look at it. And so from that has sprung a lot of information on the website for you folks' use. I don't know it all for sure. And to make it even worse, the FAA is always changing their ways they look at things. So it's a very fluid sort of environment in terms of the knowledge that goes along with these people at the FAA, and things change with time. So I try to update that on the website whenever I get a chance to. Um, like Steve said, that he appreciates the messages that come in to him for what he does. I send him messages once in a while to say how much I appreciate this website and the friendships I've made through it, and it's just a tremendous asset to my personal life. So I come in here in between patients sometimes when I just had it up to here with some of the stuff that I see, and I can just sit at this computer and answer some medical questions or just see what's going on, and it just is it adds another dimension to my professional life here and my personal life. So with that background, I just kind of want to go into the presentation about basic med and third class medicals, kind of choosing which one to do, if not both. Hopefully that will be one of the take-home messages at the end. And with that, we are going to go to the presentation. And if there's questions, Steve, did that come up okay?
You did beautiful, Randy.
Hot dog. Okay, so I'm going to go over here and click on this so I can. Okay, good. So, Clint Eastwood is actually one of my favorites, actors and now directors. And I just watched a really great movie last night called Richard Jewell. If you haven't seen that, it's really a great movie. But among other things, the good, bad, and ugly, we have that going on with Basic Med and with FAA Medicals. Gary Larson is one of my favorite cartoonists, and I modified it a little bit to put the FAA and the pilot here, and that I have always had the feeling in the back of my mind that the FAA is trying to lure me into a problem when I filled out the medical part when I was going through my third class medical and second class medical and first class medical examinations. And I think when I come into the AME's office, I always worry that is he going to find something that's going to be medically disqualifying for me? And this is kind of the way that I've looked at this in the past. The AME is there doing the examination. Hopefully he's not sticking his tongue out and making a face at the proverbial bull at the FAA, but I think we have to be very careful who we go see for our medical examinations, because sometimes the AME isn't really going to act in our favor and give us the benefit of the doubt. And small things that the AME can put on that form can make major problems for you in terms of maintaining your aviation medical examination. One of the salient points of this presentation is when you go in for your flight physical, you need to prepare for it just like you do for your flight. You need to pre-flight for your medical, so that there's no loose strings when you walk into your AME's office. And if there are some things you're not sure about, that you call and talk to them about it, or you talk to them about it before you start the examination. In particular, you want to make sure that they that you let them know of anything that you have any questions might be medically disqualifying before you give them your confirmation number. For the third class medical, when you give the confirmation number, you are giving your electronic signature. And the moment you do that, and we enter it into the computer system to pull up your profile, you're on record. And you can't change your mind at that point to take back something that you had happen. And if you get denied, you're screwed out of going to light sport and until you get your record cleared, so to speak, and you meet the conditions that they set out for you for achieving a special issuance. I'm just going to give you an example of this. Just a few weeks ago, I was up at Park Rapids doing flight physicals, and this gentleman came in. He was about 73 years old and was just learning to fly and was loving it. And before he gave me his confirmation number, I was finishing up some work and I was getting ready to type in. I said, "Hey, could you read your confirmation number to me?" And he said, "Hey, can I run something by you first?" And I said, "Sure. What is it?" And he said, last week, I had something happen that the docs at the emergency room called a TIA. And I go, a TIA? He said, yeah, I was doing something and I started having some numbness on my left side. And I had a hard time talking. And my wife was concerned about it. So she took me to the emergency room and they worked me up and it went away within just 10 minutes or so, but it kind of had me nervous. And I go, okay, first of all, did they find anything? And no, they didn't find any reason for it. And I pointed out to him that it was really important for him to have told me this up front, because if I had put his electronic signature in there and put what he had already admitted on his entry form with the FAA, that he'd had gone to the emergency room with a TIA, and that would have been medically disqualifying, and even worse, it would have been conditions for denial, and he would not have gotten his medical really ever, unless they could find a reason why the TIA happened. TIA stands for transient ischemic attack, which is kind of like a mini stroke. And so there's been partial intermittent disruption of the blood flow to the brain. And it's a serious condition. It's like having a stroke. And if there can be an explanation about why you had that, there are times you can get your medical back. But in this gentleman's case, he will never get an FAA medical certificate. Now, I pointed out to him that since I didn't enter in his confirmation number, he could go to light sport if he chose to do that. Now, I pointed out to him that there's some problems because you don't know when this is going to happen to you again. I said, why do you want to get your pilot's license? And he said, I've got 2 grandkids. They're like 3 and 5. And someday I just want to take them up for an airplane ride. And I said, okay, well, just stop and think about this. You could go light sport and get an airplane that you could give somebody a ride, like one of your grandkids. But do you really want to get in a cockpit and fly an aircraft where you're the only one in the aircraft that control the airplane, and give your little grandson or your granddaughter a ride? And he goes, no, you're right. So I mentioned that because when I show this slide, about you, the photographer and the AME here, I'm just going, there's some things here that can really screw this up for us. Fortunately, several years ago, Mark Baker, who's a native Minnesotan, helped push through the petition in conjunction with EAA and AOPA, and it ended up being the Pilot's Bill of Rights number 2. I put the picture of Mark Baker and Jim Kuhn because these 2 gentlemen were really the driving force in getting this legislation to go through. And it was just a major accomplishment for us. BasicMed states that you can fly with no more than 5 passengers. You can fly an aircraft that's under 6,000 pounds. It's authorized to carry no more than 6 occupants. Flights within the U.S., airspeed has to be 250 knots or less, and at or below 18,000 feet mean sea level. You cannot fly for compensation or hire. Okay, so that really opens it up, and opened it up so many people who were selling their Cessna 172s or the 182s or their Super Cubs could come back to flying as long as they had some certain conditions met. Now,
Randy, can I interrupt you real quick?
Yeah.
Are there some countries now that recognize BasicMed, like the Bahamas?
There are the Bahamas. Mexico apparently will recognize BasicMed. Canada does not. And Steve, I just called Mark Baker about half an hour ago. That's why I was late checking on, to find out what the current state is with BasicMed in Canada. And his response was that they had an ICAO meeting recently, and a Dr. Berry from the FAA got up and made very strong statements that there's not enough when he was asked, is there enough data to show that BasicMed is safe? And he told the Canadians that there was not sufficient data to support BasicMed. And so it is going to delay things. But Mark told me that come hell or high water, he's going to push every possible mechanism he can to get Canada to recognize BasicMed.
Great.
So, yeah, thank you.
Thanks.
Okay, so this is a time comparison between BasicMed and third-class medical. BasicMed up on the top, you do a comprehensive medical examination with your physician. You do a medical update online with the AOPA or with Mayo Clinic. And if you have a special issuance, you have to have a one-time special issuance for any major medical problems that are medically disqualifying by the FAA. We'll elaborate on that pretty soon. Every 4 years, you have to have another examination. You have to, every 2 years, go online and redo the medical update. And the medical update is to try to make us be aware of things that might change with regard to current aviation medicine. So that's the scenario. Contrast that with a third-class medical with or without a special issuance. If you don't have a special issuance, every 2 years for most of us. If you have a special issuance every year, you have to meet the criteria that are specified in the special issuance that you're given by the FAA. So, for example, if you have had a stent placed, you'll need to have certain documents provided to your AME, who will in turn submit those to the FAA, or you can, better yet, directly submit it to the FAA. Through your regional flight surgeon would be my recommendation. And you can just see there's a lot of difference between the two just based upon that for the third class versus BasicMed. Who can fly? Any pilot who had a valid medical certificate after July 15th of 2006, and applies to both regular and special issuance. So just because you have a special issuance for some problem, it does not disqualify you from going BasicMed. You have to have a valid U.S. driver's license. You have to have held a medical certificate at any point after July 15th of 2006. That's where the 10-year look-back period goes. This date was chosen because that was 10 years from when the legislation was signed into law by the president. Answer health questions on a comprehensive medical examination checklist. Get a physical examination by a state licensed physician. And then take an online medical course, and at the time of that course, you have to enter in the specific information about the physician who performed your examination. And each state has specified what they consider a state licensed physician. So you qualify for it if you've had a valid first, second, or third class medical at any time in that 10-year look-back period. If you had a revocation or suspension or withdrawal or denial of your last medical, you are not eligible for BasicMed. You have to go back to the FAA, complete at least a third-class medical before you can go BasicMed. If you develop cardiac, neurological, or mental health conditions since the last valid medical, it's also disqualifying for BasicMed until you meet the special issuance from the FAA, and you have to have a valid driver's license. Sometimes the question here is, I've been asked this a number of times, what circumstances do you need an AME flight physical first? If you've never had a medical, if your medical expired more than 10 years before that look-back period, and if you don't know, you can contact the FAA and they'll tell you where you stand with that. Now, they broke down in the law that was passed and signed in 2016, 3 major categories of disqualifying things that would require you to have a valid medical before you could go with a special issuance or with BasicMed. If you've had a heart attack or myocardial infarction. Hey, Steve, when I move my marker here, cursor, are they seeing that?
They are.
They are, thank you. Okay. Coronary artery disease required treatment, i.e. cardiac stents, cardiac valve replacement, and heart replacement. So those are the main things. And the one I see the most of are people that have not had a myocardial infarction, or they have had it and they've had stents placed. If you have epilepsy or transient loss of control of the nervous system, i.e. that gentleman I told you about that came in, that I was able to intercept him before he gave me his electronic signature. He did not have a satisfactory medical explanation about why that happened, and any disturbances of consciousness without some explanation. For mental health conditions, personality disorders, psychoses, lots of different categories there. Bipolar disorder is one that's really universally disqualifying, and substance dependence or substance abuse in the previous 2 years is defined in the FARs. So those are the three major categories of why you would need to go get a one-time special issuance, and then you can go basic med, and you can keep that basic med going until you have another one of these conditions happen that would require you to go back and get another special issuance. So AOPA made it very easy to do the basic med. You go to their website. This was a screenshot I took of the opening part. You do the course. Takes about 20 to 30 minutes to do. And after you finish that, you do your comprehensive medical examination. You have to go to an MD, a DO, or a chiropractor in some states. Dentists and podiatrists, not so much in terms of their qualifications. Nurse practitioners cannot do these. Physician's assistants cannot do these. There's a section for you to complete. There's a section for the physician to complete. And keeping in mind, just like in section 18 on your on the medical examination that you complete online, if you've added any time in your life any of these conditions, you check yes. So here are the different categories, and obviously don't expect you to go through to read all these, but these are the list of the questions they ask you. Have you ever had these things? And if you've ever had them in your life, you need to specify it. Now, one of the differences between basic med and third-class medical is that with a third-class medical or second-class medical or first-class medical, I, as an AME, am not your physician. I am the instrument that the FAA is using to make measurements. So I'm measuring whether or not you have had these problems. Under basic med, if you come see me, I become your gynecologist, okay? Or your physician. And so while you may have been answering these questions on the FAA medicals, I don't know that as your physician, unless I was your physician in the past, which I know that is a fact. I have none of your physicians in the past. So you've got these things to mention to your doc. So when you go in for your basic med the first time, for example, if you're coming to me, I want to know if you've ever had high blood pressure, low blood pressure. I can make a comment about it. It's not disqualifying, but I need to know about it. You can't just put previously reported like you can with the third-class medical. This is a form that you download from the FAA's website or from AOPA's, and you can see that it is laid out exactly like the online version for the MedExpress. Down here at the bottom is where you've ever had any of these problems, yes or no. And if there's a yes, you put a check mark and you put a little explanation over here in the right-hand margin. And if there's not enough space, have another piece of paper and put it down there. Okay, it has exactly the same sort of information that you ask on the MedExpress. I just magnified this some. And then down at the bottom, you check to say the answers provided me are completely true, are true and complete. You understand blah, blah, blah from the FAA. You're aware of regulation pertaining to the prohibition of operations during medical deficiency, and I have no medically disqualifying conditions. You print it and you sign it. And then your part to that is complete. You take that into your doc. Now, this visits to health professionals the last 3 years. Most of us have had some sort of things go on, like you get treated for a head cold or whatever else, or you had kidney stones. You put down a yes here and you explain what it was you did, where you went. Do you ever use any medications, prescription or over the counter? Yes or no. And if you did, you write down what it was. Now on the FAA's MedExpress, they ask you for the dosage, the interval, and the medication. You should really provide the same thing to your doc who's going to be doing the basic med exam. If you're going to your family physician or your personal physician who knows you, you don't have to sweat this stuff because they've already got this in your medical record. And they may be willing to not have you list all that stuff, say, heck, Steve, I already know about all this stuff. You don't have to worry about, you don't have to list that all for me. But if you're going to a new physician, they need to be aware of any conditions you have. And when you enter into that physician-patient relationship with that doc, you are also entering into the agreement that if something changes with your health in the future, after he or she has signed your basic med exam, that you're going to let them know, because we have no way of tracking that. So we're relying upon you letting us know that you had some problem happen. And so that we have the option to say, you know what, I'm not comfortable signing this under basic med for you any longer. You then take it to your physician and they fill out this form. And this form is another shortened version of exactly what we fill out for the third class, second class, and first class medical. They make it very generic. So for example, under vision, distant, near, and intermediate vision, field of vision, color vision, and ocular alignment. That's something we check when they do the flight physicals for FAA for the first, second, and third class medical. But they don't really, they just say examine. So the doc could just check that. It doesn't leave room for any explanation. And I'll show you how I deal with that pretty soon. The doc then checks this, saying that I certify I've discussed all items on this checklist, discussed any medications he or she has taken that can interfere with his ability to safely operate an aircraft or motor vehicle, performed an examination that included all the items on the checklist. Now, that becomes a rub, because most of our docs don't have a vision chart up on the wall to check for your vision. Many of them don't have the ability to check for near vision. They may not have the ability to check for color vision. So some docs are just say, you know what, I don't have the stuff in my office to do this. But in our office, we have these things all set up for us so we can easily do these in our offices. I print the pilot's name, date of birth, and then I sign it. Importantly for you, I need to be putting in this information about my medical practice. So I put Corfman, Randle, my medical license number, the state in which I did the examination. So for example, last year at New Holstein, I did basic med exams on a number of people, and I'm licensed in Wisconsin. That's why I can do those examinations in Wisconsin or North Dakota or Montana or Alaska. I can't do these things in Iowa, can't do them in South Dakota. The FAA, on the other hand, they designate where I can do medical examinations. So for those of you who I've done exams on, I either do them here in my office in Maple Grove or in Park Rapids. They specify where you can do your flight physicals. I can't just go do them anywhere. So over there, for example, I did basic med exams, but I couldn't have done a third class medical had I wanted to. Okay, and I want to put down this. The physician is instructed to exercise medical discretion to address as medically appropriate any conditions and to exercise discretion in any other tests that need to be performed as a part of the examination. That gives a lot of latitude to the doc. I'm supposed to also discuss any medications that the person is taking that might interfere with the safe operation. Now, let's say you go through this and I go at the end of it and go, you know what? I think you should have a stress test. I think you should have a colonoscopy. And I'm not going to sign this till you have it done. Well, what are you going to do? Well, this is not part of the record for the FAA. You could go to another physician, and that physician might be more reasonable in your opinion, and that person may be willing to sign it without going through all those extra tests. So the intent of this is to make it so that you will be more likely to air your dirty laundry, so to speak, with your primary physician rather than you would to an FAA medical examiner. Okay, so this is just blah, 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 blah. So review the checklist. You have to have a valid driver's license. You have to complete your section. The doc has to complete their section of the basic medics checklist. do the online medical education course, put my information about my medical license in there, and they will give you a course completion document that you're certified. You then put the examination and the medical education course document, your certificate, in your logbook, or keep it in a place you can get to it easily. Then make a logbook entry stating that I have completed Basic Med on this date. Now, back to the thing about having this exam done every 4 years. It's your responsibility to keep track of when the 4 years is up. You know, I know that even with the FAA medical certification, once in a while a pilot will call up and say, "Holy crap, my medical expired 3 months ago. Can I come in and get a flight physical done?" Well, the same thing is true here. It's up to you to keep track of when it's time for you to do the 2-year review course, and when it is time to do the logbook, or when it's time to do the Basic Med again. Enter into the logbook, and my advice is to keep a copy of that certificate that you get from AOPA with you in your logbook, or keep it in the aircraft. If you fly one aircraft routinely or multiple aircrafts, put it in your flight bag. The reason for that is you'll see pretty soon if you get ramp checked, they're going to want to see your valid first, second, or third class medical, but they're also going to want to show that you completed the course. And if you have that certificate on you, you've got it made in spades. And otherwise, the regional flight, the FAA FSDO office here tells me that they are just going to give you 72 hours to produce that document for them.
Hey, Randy.
Yep.
You mentioned to me recently that you had spoken with somebody, and they had done the Basic Med examination, but they hadn't filled out the online form. They hadn't done that after the exam thing, and that basically meant that they didn't have Basic Med. So just going and getting the exam, I think it's just good to emphasize the fact that just going to get the examination isn't good enough. You got to do that follow-up piece, or it doesn't count.
Yep. This individual happened to have been one of the victims over at New Holstein. I did their Basic Med exam, and passed it just fine, and went home and didn't go online to do the course. So, and this person developed a medical problem that might have been disqualifying under third class medical. It wouldn't have been disqualifying under Basic Med. So it had been almost a year since I'd done the examination. So when he went online, he entered in the date of the examination, and that then was valid from that date to the time he completed the form. So he kind of had I hesitate to use the get out of jail free card, because this is not a get out of jail free card. Mike Vivian was kind enough to suggest that I'd talk about that for a minute. Basic Med it does give us some flexibility that we don't have under the FAA medical examination, but it is not a get out of jail free card, but it can make us fly with some conditions you'll see in a minute that would be medically disqualifying for us otherwise.
Hey, Randy, because we're right on that subject, I got one more question. Sorry.
Yeah.
So if you, and I did this very thing, it's okay to take digital copies of this, like take a picture of it, save it in your ForeFlight documents or in your Google Photos or whatever, so that you can display it, right?
Absolutely.
Okay.
Yep, that's a great idea. Okay, so if you're ramp checked, the information I got on this slide came when I called the FSDO about a year ago and said, "Hey, what do you guys do when you ramp check somebody with a Basic Med?" And the inspector said, "God, I don't know. I've never had anybody have that situation come up." So he said, "You're going to need to show your pilot certificate, your medical certification from the Basic Med, that little card that either Steve pointed out you could put on your iPhone, or the little wallet size version that they give you, and then your other things that go along with the ramp check." So that's how you would do it with the Basic Med exam. Photo ID, your certificate, and just the basic document that showed you passed it. Okay, so pre-flighting for your flight physical, this is a checklist that I use to flying the 210, and I add on my own stuff down here in the bottom right for flying IFR. Um, Really, I would encourage people to do this very religiously before you get your flight physical or before your basic med exam. Uh, I would say 1 out of 4 people that I do flight physicals, third class medicals on, had something go on since their last medical that they weren't sure was a problem, but they show up and they don't tell me about it till the time they come in. And sometimes they have to go back and get documentation so that I can say I can sign their medical. Um, Fortunately, the AME has 2 weeks to submit that application. So if I do the examination on you today, and there's some things you just didn't get together for me to be able to allow me to sign it, you have 2 weeks to get that to me before I go into doghouse with the FAA for not submitting the flight physical in time. There have been times in the past where, and they've really cut down on this, the FAA has, that a doc would do a flight physical and then 3 months later submit the information to the FAA. FAA legal has read them the riot act because that's a problem for them because they can't do any enforcement action if that document hasn't been submitted to the FAA. So they are really on us to make sure we get this thing submitted. And if we don't do it, we get dinged and so many dings and they're out of the ball game. Because they point out to us every time I go to one of these recertification meetings that we serve at the pleasure of the federal air surgeon. And the federal air surgeon can pull my ability to do flight physicals for any reason they choose to do so. So it's something that we are very careful about. Now I
Randy,
wonder,
is that 2 week submittal thing for all medicals, basic med and the regular medicals?
FAA medicals,
Okay.
basic med.
Well, like you said, the guy did it a year later.
Exactly. Yep, exactly. So it's only for the FAA. But I think it's something. What I suggest that folks do is they go online and they do the medical the online thing first. You can't complete it because you can't put in my information and my signature, my medical license number. But then you go in and do your flight physical part, and if you decide not to do the flight physical and complete the basic med, it doesn't go against anything. It just stays in the AOPA system for a period of time and it gets purged. Now, I want to talk about FAA complaints for the medical certificate because there's a significant difference between how the FAA looks at problems if you have a valid FAA medical certificate compared to basic med. We're going to do the FAA third class medical first. Let's say that I'm watching Steve Johnson do something around the office or at New Holstein. And man, he's out of control, and I think he's got a medical problem that I'm worried about. Not just me. Any of you could do the same thing. You could file a complaint about Steve Johnson anytime you choose to do so.
Get in line.
Okay. Get in line. Right. Okay. So you could call this 800 number, and you could say, hey, this guy has got a medical problem, and I think he should not be allowed to fly. And I think he's unsafe. They're going to decide whether or not it's necessary to examine it or whether they should follow up and see what's going on. And they can request the pilot to go through another examination. And if the pilot refuses to do so, they fail, and they will ask and they will seek legally the surrender of your medical certificate. If the pilot says, okay, I can answer that, get the results, the certificate remains in place. Okay? Now, I'll give you an example about this. There was a gentleman that contacted me that he had a problem with a local person on the airport. And that person had contacted the FAA and said, this pilot has a medically disqualifying problem. And and it's significant, and I'm worried about it being an immediate danger to the public, I think he should be grounded. The FAA contacted this pilot, who actually was a professional pilot, retired, and took his medical and said, your medical is invalid until you have an examination by a subspecialist that they specify who you can see to show that this is not a problem. So this pilot, who's a supercub.org guy, contacted me. I said, I tell you what, give me the information. And so he submitted it to me. I submitted to my regional flight surgeon. I called him up and said, hey, here's the situation. We think it's just because this guy wanted to get even with him and cause him problems. And my regional flight surgeon said, tell you what, Randy, have him come up, you do an examination on him, and if this turns out to be nothing, he's got no issue, he can resume his flight status. And so that's what the guy did. Came up to Minnesota, I did an examination on him, he was fine, and I called the regional flight surgeon, they immediately reinstated his flight privileges. So this FAA hotline thing can be really a difficult thing for pilots. Different with BasicMed. BasicMed, if somebody calls and says Steve Johnson's a problem, the FSDO investigates, not the FAA Medical Division. So the local FSDO investigates it. They can determine it's unnecessary to do any action, or they can say enforcement needs to happen. They'll request to surrender the license. If he refuses to, FAA goes through legal action to strip you of all of your ratings, not just your medical certificate. You lose your private pilot, you lose your instrument rating, you lose it all. Or the pilot can just say, forget it, I'm going to surrender the license. Now, to date, I don't know of this happening, but one of the big differences between BasicMed and third-class medical is this paradigm. With the third-class medical, the medical people at FAA investigate it. They have specific criteria. And in this gentleman's case I was telling you about, that's what we did. But under BasicMed, it goes to the FSDO, and these guys don't know shit from Shinola about how to deal with these sorts of things. And so it's really a problem, I think. So we have to
Randy, they wouldn't just suspend your certificate, they would actually revoke it. That's their only course of action.
That's their course of action.
So it's not like if you landed gear up and you had your certificate revoked for 30 days or 60 days or whatever. It's actually just a full, wow.
Free revocation. And so you'd have to start all over again. You have to get all of your ratings back. It's a potential significant problem. So that's the downside of BasicMed.
Now, I'm going to ask a question during this because you're a proponent of having both a BasicMed and a Class 3, right? So, or Class 2 or whatever. So, so let's say that that somebody calls in and says, Steve Johnson is drinking and flying or whatever, and or whatever gets their attention, and they come to me. Will they choose which medical they're going to pursue in that case? Because I carry both. I've got both right now. So do I risk the chance of getting my licenses completely revoked, or do I say, no, wait, I only drink and fly under my Class 3?
I don't think that's been tested. No, it's a really good question. And I think it's a gray area. The thing that I think that is reassuring to me on this flow chart is that this thing, whether they think enforcement action is deemed necessary, because most likely for most things, if it's a grudge sort of thing, I think that they will see through it. But they're not in a position, for example, the gentleman who had the medical problem, they're not in a position to assess whether there's a problem there or not. And they don't feel like they can call Oklahoma City to ask them the question, because Oklahoma City wants to have nothing to do with BasicMed. they want to wash their hands of it. So it's going to be all in the jurisdiction of the FSDO.
All right. And by the way, Randy, I've gotten like 10 private messages already asking who turned me in.
That's a long list, Steve. That's a long list. Okay. So how do I find a physician to conduct the basic med? Any physician is familiar with your complete health history would be a good choice. Also, some AMEs may elect to provide the examinations under basic med. I'm one of them, but I'm one of the very few that does. Most AMEs are not doing this for political reasons that we can get into later on if we want to. My state licensed physician who conducted my medical exam refused to sign the evaluation. What can I do? You just find another doc and see if you get somebody else to sign it. Not true if you do a third-class medical, and if at the end of that evaluation, I have to say issued, denied, or deferred. Those are my choices. And you can't say, well, gee whiz, I need to go to another doc and find out what's going on. You can't go to another AME at that point. You're tied in with that AME, and the FAA may choose in their infinite wisdom to let you go have another examination performed to show that that was not a problem. I'll give you an example of that. There's a gentleman that came in that I evaluated recently who had not had a flight physical for 7 years, and third-class medical. And I did the examination, and for one thing, one of the things that he forgot to tell me about before I started the examination was that he had been treated for colon cancer about 2 years ago. And he wasn't treated with surgery or with chemotherapy. He was treated with homeopathic remedies. And he was still living, and he got better, but he still had unresolved cancer issues. So that was one thing, I couldn't issue his medical because I had to defer it from that standpoint, knowing that he's going to have to get records together. FAA is going to take a look at it to see whether or not they'll issue a special issuance. I said, I always ask these guys, are you colorblind? Well, that's a hard thing to ask a supercub.org member if he was a supercub.org member, because we don't know how to match our socks usually are not matching, much less asking if they're colorblind. So this guy said, no, I'm not colorblind. So I said, okay, well, I haven't examined you before. Take a look at it. So I went through the book. This guy was colorblind. Yet whoever the AME that passed him in the past had said he was not colorblind. So it put if I pointed out to him that his remedy for that would be to only be able to fly at night. He could only fly at night. He could only fly during the daytime. He couldn't fly at night because he wouldn't be able to recognize the color signals from the tower. The other remedy he has is to seek someone that has a Farnsworth lantern test, which is an old test that many people who test colorblind by the FAA's mechanism might be able to see colors well enough to pass it on that. But unfortunately, there's not many of these Farnsworth lanterns around the United States.
But Randy has 3 of them.
Right. I wish I did. I don't. But I know the guy that does it. I know the guy that has it. So I was at the last refresher that I went to out in Colorado. The guy that gave the talk was an ophthalmologist from La Crosse, Kansas. What's his name? I got his name number somewhere. At any rate, this guy is a retired ophthalmologist, and he is a speaker for them and on their panel for eye problems. And I said, he showed a picture of a Farnsworth lantern. I went up to him in the intermission and said, where do you find a Farnsworth lantern? He said, I got one in my basement. You do? Are you still doing flight physicals? He said, yeah, I do them out of my home. I'm retired now. So I have an office set up downstairs, and I do the Farnsworth lantern. So any of you that want to get that waiver removed, you can get a Farnsworth lantern test performed by this guy. And if you pass it, it removes that restriction off of your medical. Okay. Here's some concerns that docs have about signing doing the basic med. I don't have the equipment to do all the checklist items. To do this exam will take a long time because, you know, a lot of these docs, they have like 5 minutes allowed to do your examination, and they may not take the time to do this. So that could be a problem for them. They could say, I'm not familiar with the effects the medications have on my patient's ability to safely operate an aircraft. And a good example of that is Benadryl. Benadryl is a really unsafe drug. And you have to go through 5 half-lives after you take one Benadryl tablet before you should be flying. It builds up in your system, and it can lead you to having some very unsafe behaviors. But most people don't understand that. Some people take Benadryl at night just to help them sleep better. It can be a very unsafe medication. Another reason I'm not familiar with all the medical conditions that could interfere with the ability of this guy to operate an aircraft. Another valid criticism is, will my medical malpractice insurance cover me should tragedy strike my patient pilot? That's a major concern when this first came out, BasicMed, and I had to go to our state insurers, medical malpractice insurers, to get them to understand that this was not really a major issue for malpractice. And lastly, if my patient is involved in an accident, will I be likely to be named in a lawsuit? And the answer to that is probably I would be. So that's a major issue, and that's why we would like to make sure, I made sure before I started doing basic med exams, that my malpractice would cover this should be a problem. Now I'm listing here the 15 medically disqualifying conditions that the FAA states are reasons for you not being able to get a medical without a special issuance. And some of these are just simply disqualifying. Angina, in other words, symptoms for myocardial infarction, bipolar disorder, a valve replacement, coronary artery disease that's been treated or if untreated, been symptomatic or clinically significant, i.e. stents, diabetes mellitus requiring insulin or glucophage, disturbance of consciousness without satisfactory medical explanation of the cause, epilepsy, heart replacement, myocardial infarction, pacemaker, personality disorders. These are some that when they be severe enough to have repeated manifestations of overt acts, if these people are just simply not willing to follow the rules. Now, many of us don't like the rules, and some of us break rules once in a while, but there's some people that they just cannot help themselves. If there's a line, they're going to step over that blasted line every time they can. That's something that the FAA, in my opinion, appropriately does not want to have as a part of the pilot's profile. Psychosis, substance abuse, loss of consciousness. So if you develop any of these things since your last medical, you've got to go back. Your basic med is invalid. You got to go back and get a one-time special issuance. Myocardial infarction, stents, valve replacement, heart replacement. This is just a review of what we said earlier. Epilepsy, loss of control, loss of consciousness, personality disorder, psychosis, bipolar disorder, substance abuse. So, what medical conditions are disqualifying FAA medicals that do not disqualify for basic med? Basically, any condition other than those 15 that were mentioned. Now you might think, holy crap, that's a lot of conditions. But these are the most common ones that I see. Cancer for us guys of the prostate, colon cancer for men and women, upper GI, throat cancers, kidney stones, thyroid disease, prediabetes or type 2 diabetes. These things all require, at the very minimum, a CACI, and I'm going to show you what CACIs are here in a minute. CACIs they abbreviate condition an AME can issue. A series of conditions which allow AMEs to regular issue if the applicant meets the parameters of the CACI condition worksheet. The worksheets provide detailed instructions to the examiner and outline condition-specific requirements for the applicant. So, we are to review the disposition table before we see the patient, the pilot, verify that a CACI is required. If all the criteria are met and the applicant is qualified, we can issue. We don't have to submit anything to the FAA to Oklahoma City. We make a note of it in a certain block on the medical, and we keep the supporting documents in our files. They do not need to be submitted to the FAA at this time. The key term there is at this time, because in the future, FAA can call me as your AME and say, hey, I want to see those documents. If the requirements are not met, the AME must defer the exam and send the supporting documents to the FAA. Now here's some examples. These are the most common ones. And these things were a major improvement, you guys. And this all happened about 4 or 5 years ago. Remember when the FAA was really shut down, basically for budgetary reasons, until money could be appropriated. And they created these things to make it so there would be not such a backlog. Hypertension. They list exactly what I need to know. And down at the bottom, I can check CACI qualified for high blood pressure. You don't need to submit anything to FAA. Here's what I have to know about you if you have high blood pressure. The treating physician or the AME finds a condition stable on the current regimen for at least 7 days and no changes are recommended. If I say yes, we're good. No symptoms. Blood pressure less than or equal to 155/95. Any acceptable medications. There's just certain few that are not medically approved. If I can check yes, none, check this, adequate thing, no side effects, then I can submit it. So the examiner reviews that information. If the applicant meets all the acceptable certification, I can issue. If the guy has a first or second class medical, they have to provide that information annually. Under third class, you provide the information with each required examination. They came up for one with kidney stones. Sometimes it isn't just kidney stones. There was a gentleman over at New Holstein last year that came to my tent about 4 o'clock in the morning and was dying. And he said, Randy, I need your help. So I came crawling out of the tent and we examined him, and I thought it was a hot appendix, and it turned out being a kidney stone. They're very similar presenting findings. And he got through it without any major problems, and he's still real healthy.
And what was he able to do that day that he wouldn't have been able to do under a class 3?
He could go fly his airplane. He could have flown his airplane home. Now you might say, is that a good idea? Well, the answer to that is when we fly an airplane, we self-certify that we're okay to fly the airplane unless we have a medically disqualifying condition. Now, under BasicMed, this gentleman had passed the document that he'd already passed the stone. There were no residual stones left. And so if he felt that he could fly an airplane, he could fly an airplane. Just same thing many years ago, I had a complication of a colonoscopy, which is a long story, but I was in an intensive care unit for a number of days. I'd flown my 210 over to a neighboring city to have this examination performed because I thought my tush was so special. I didn't want the nurses around here to see it, and had a complication. There I was in a hospital bed coming out of ICU. My 210 is sitting there, and I'm going, how am I going to get this thing back home? So I called my AME and said, hey, Phil, I just had a big surgery, and do I need to submit stuff to you like right now? In order for me to get at some point fly my airplane back? And they said, Randy, you self-certify every time you fly. If you had that surgery appendectomy yesterday, or you had in my case, 1.5 feet of my intestine removed, and you felt like flying the next day, you could do it legally. You don't have to tell me about it. You don't have to tell the FAA about it. In fact, in my opinion, you shouldn't tell the FAA about it. You wait till you recover till you feel that you can meet things, and as long as you don't have a medically disqualifying event, it's not a problem. Now, what happens if they would have done the colonoscopy, took a foot and a half of my intestine out, and found out that I had colon cancer? Whoop, time out. That's medically disqualifying. This guy having a rhinoceros stuck in his back, that's probably going to have trouble for him to operate a Super Cub. Same thing true for prostate cancer. Certain criteria can be met, and as long as I can check out yes to all of these things, the PSA is less than this or this, no symptoms, we can issue. He doesn't have to get a special issuance. I don't have to turn any of that into the FAA. These are a list of all the khakis that are currently available, and it's a really nice list. There's a lot of things here that affect us, that these things are essentially all medically disqualifying under FAA Medical, but they would not be medically disqualifying under BasicMed. So, in review, this is a comparison between BasicMed and third-class medical. Can I hold a third-class medical and a BasicMed at the same time? The answer is yes, and in my opinion, you should. I've had several Super Cub friends who have come to see me for BasicMed, and some of these guys were airline pilots, and they're going, why would I want to get a BasicMed too? And because I have to keep a first-class medical for the FAA. Well, what happens if you happen to come down with a bad case of a treatable cancer? You will get your special issuance from the FAA anywhere from 6 months to a year from now. But in the meantime, you can't fly your Super Cub because you're medically disqualified. But under BasicMed, you can keep on flying your Cub as long as your doc felt that you were able to do so. So I think it's a little bit of perspective, and I want to end it with this. This is a story somebody told me quite some time ago. This is a teacher in grade school that was going to do an object lesson, so she asked each child to come up and put something on the blackboard and explain what it meant. So little Johnny put, "This is a house." And she thought, well, that's pretty good. So then Susie came up and she said, "This is the sun shining on the house." Teacher was pretty pleased. Shirley came up and said, "This is the snow in Minnesota on the house, and the sun is shining on it, melting it." In the back of the room, Dirty Harry was back there waving his hand, and she'd been ignoring him, not really wanting him to screw things up. She thought, oh, what the heck? Okay, Jimmy, come on up. So he comes up, and he puts, "This is a door on the house that the snow is on top of and the sun is shining on." She's going, this is going really good. So the last little kid was back there, and he said, "I want to finish it." So she came out, he drew this. "This is my daddy picking up a bar of soap." So it's a matter of perspective, folks. And with third-class medical, it goes from this to this. You and your physician are in this together. FA Medical is not wanting to have anything to do with this picture. The lawyers are the culprits here. I should say the culprits, but they're the ones that we're all afraid of, because if there's a problem, then my medical malpractice is going to be at risk because I become your physician. So I'm going to leave it right there, Steve, and entertain any questions.
I have some questions for you backed up. If you want to unshare your screen, then we can see the earnestness in your face.
Uh-oh. Okay, got
Excellent. So the first question actually was a while back, and I thought it was something you addressed in this thing, but was to talk a little bit about sleep apnea, because it's a big deal to dealing with the FAA, and I know that's kind of a pet subject.
Right. Sleep apnea is medically disqualifying under third class medical, second class, first class. And what they require you to do is to have a sleep study, and then on an annual basis, submit a note from your physician that you're compliant. You have to submit the computer readout to show that you're compliant. And I don't remember, I think you have to use it at least 6 hours a night, and you're supposed to do it, I don't remember what percentage of the time, maybe somebody on here knows, but it's like 60% compliance or 80% compliance. If you don't do that, then they will not give your medical. And under BasicMed, it is not medically disqualifying. But
Good.
Steve, it brings up a really good point in that when you guys get your BasicMed exam performed, hey, if the sun's shining in here, if it's reflecting off my forehead and it's blinding you so you can't think right, guys, just let Steve know and I'll pull the blinds. When I do your BasicMed examination and you go off to wherever and you have a medical problem that you think might be disqualifying, you really have got to let the BasicMed doc know that you had that, so he or she can change their mind. So it's not like you get it examined in 4 years, you go and, man, you could end up with all sorts of medical problems. You don't have to let the doc know, because my medical license is on the line there. And I can tell you what would happen. Let's say, for example, I did your BasicMed. You went out and you had colon cancer. You went through chemotherapy, and one of the chemotherapy drugs caused a neurological problem for you. And you went out and you crashed an airplane and you hurt somebody. My first defense is going to be, hey, I was operating under the understanding that nothing had changed significantly from the time of the BasicMed exam. And all bets are off, and that's what my attorneys would be doing. That's how my defense would go. So it's important to know that. So sleep apnea, it's not a good thing to have. And it's dangerous to not have it treated. And so how do you treat it? Well, one way is to have surgery to have the back of your throat carved out. Another treatment is, which actually, by the way, has been shown to not be particularly effective now. The most common way is CPAP. And the third way is a dental appliance which brings your jaw forward just a little bit to allow you to pass the air in the back of the upper airway better. So CPAP machines are okay under BasicMed, but they're not okay for third-class medical. So I don't know if that answers your question, but that's how that goes.
So here's a couple other things. So question from YouTube. So you were talking about not entering the MedX number. Do you, as an AME, are you willing to do like a pre-exam before, to ensure the medical will be issued before you enter the MedX number?
No, but I am willing to answer questions that you might have that you're not sure what it's going to mean. And I would rather have the discussion, and I do it off the record. So I don't do like a pre-examination, lay hands on you and do measurements. I would just say, hey, look, if you proceed with this at this point, you're putting yourself at risk of denial or me deferring and the FAA denying you. My AME personally, Steve, does about 9,000 flight physicals a year, and I'm serious.
Seriously?
Yeah, and I asked him, how often do you deny somebody? And he said, I have never denied anybody. He defers.
Right.
You defer and you let the FAA be the bad guy. But I like to take it a step further and say, hey, look, before you even come into the office, before you give me your confirmation number, if you have any issues that you're concerned about, I'd rather know it so you can pre-flight it. So when you walk in, we have a good chance of understanding what's going to go on. So for example, let's say you had a stent put in since your last third-class medical, and you can't go under BasicMed because now you're medically disqualified. You got to get a one-time special issuance. My preference is to gather the information that's necessary for the FAA to okay you, I can look it over and say, you know what, this looks dicey. I don't know that they're going to go for this. And then that gives you the opportunity to stop and maybe go back to your cardiologist and say, hey, look, there's still some problems here. And can I get these things tuned up so that I can pass the FAA medical? Because as some of you have found out, the FAA takes a dim view of some of the advice that's given by our cardiologist, and they only trust their own cardiologist. And so I know some of you have been going to other places, parts of the country. Some people come to Mayo Clinic. Some people go to Cleveland Clinic. Those happen to be a couple places the FAA has some faith in, and they look at whatever they say as gospel.
Very good. So a couple of people have asked this sort of the same question flipped on its head here. One of the YouTube guys wanted to know, as a pilot currently under BasicMed with no health issues, is there any reason to choose one over the other going forward? Like for aircraft rental or FBOs requiring third class? Have you heard anything of that?
I have not heard that, but I've not heard of any FBO or rentals being discriminated by BasicMed or third class medical. But you know what? That would go back to their insurer.
Right.
You know, early on when BasicMed came out, the big problem that Mark Baker had was convincing the insurance companies that the BasicMed was not going to pose any more significant risk to their customer than otherwise. And he was successful in doing that, because I don't know, and this thread has been discussed on supercub.org, that they're I don't know of anybody that's been discriminated against because of BasicMed. The only reason for not going BasicMed, in my opinion, is if you want to go to Canada. Now, right now, you can't go to Canada really if you wanted to, but if you wanted
so
to,
that means you want to go to Alaska and you're from the lower 48.
Well, there's this guy named Bill Rusk, so
Who
you
flies
may have heard,
nonstop.
who flies nonstop from Washington to Ketchikan.
Right. He's got big tanks and a big bladder.
And big. Okay.
Okay.
So, but the reality of it is, for when you make that trip, if you stop and land someplace in Canada, you've officially violated the law. But if you happen to land out there in the middle of nowhere on a lake and refueled with a bag that you have down underneath in your cargo pod, you might be able to do it and get away without getting detected. But that's a whole, not that I would ever suggest anybody do that, but there may be some people that would consider that.
Right. So there's another question. The cancers that are disqualifying for BasicMed. Why do you feel like it's those cancers but not other cancers?
Say that again, Steve.
So there are some specific forms of cancer that are disqualifying for BasicMed. And the person asked why those cancers but not others.
I don't remember any of the cancers are disqualifying.
Oh, maybe he was talking about for regular medicals.
That's an excellent question.
He didn't specify.
I did not, because I don't know of any cancers that would be, well, first of all, when you look at the law that was passed, they did not address cancers at all.
In BasicMed.
In BasicMed.
But what about in Class 3? Are there cancers that are okay in Class 3 and cancers that are not okay?
There are. So like with most of these cancers that I mentioned that are no issue at all with BasicMed, you can get a special issuance for third class medical. It's just going to take you a while. And you run the risk of them not accepting it.
Yeah.
They may say, no, this is not good enough. You're disqualified, and they'll deny you. Then you're screwed. But I also look at it too, Steve, that if somebody has a significant cancer, I was given advice by my AME when I started doing flight physicals said, Randy, if this person you're examining, if that's after you examine them, that's somebody that you would not fly with based upon his or her judgment or a medical problem, you can defer just for that reason. And so I don't do everybody's basic med.
Right.
For example, I had a gal come in and she had a body mass index of 39. And in addition to have a significant weight and balance problem, and she had sleep apnea. She's a significant risk for sudden death. And I go, you know what? I don't have a specific body mass index that I use for passing people for basic med, but you are not healthy. I wouldn't fly with you. I certainly wouldn't put my grandchild in the back seat of an airplane that you're flying. So I won't pass you with that. But you can go to somebody else. They might let you. They might sign it.
Right.
Yep.
Hey, so this is a very serious question here. Probably maybe the most important question tonight. He says, I see a model on your work desk that appears to be a Super Cub. Are you a Super Cub pilot?
Well, I am a Super Cub pilot. It's the Super Cub. Oh man, it's just been a it's fun to fly, but the main importance of that in my life is the people like you folks that I've met that make it.
It's a lifestyle airplane. It's a
lifestyle airplane, man. So I didn't say I'm a good pilot, but I can fly it.
Okay, I got another question here, which might be the last one. And you know this guy. But he said, I almost never hear of any accidents in airplanes caused by medical issues with the pilot. Yet, once in a while, there's a heart attack and the passenger miraculously lands the plane. How often does a medical condition actually cause a real problem with a pilot flying? Does anyone know? And how often does it happen?
I don't know the answer to that, but the FAA, I can tell you, the slide I didn't, I did want to tell you guys that one of the most common messages I get PMs through supercub.org is that many of you are going to have a stent placed in your heart in the next year. I mean, it's common.
Can you tell that from just seeing us on this Zoom call?
Nope.
Okay.
Nope. It's just a fact, and it's not it's not because people are many times you would never suspect they got a cardiac lesion, but many of us will have it. And so the question is, what do I do to get my license back? There's a thread if you do a search on supercub.org for stents. I specifically say exactly what you got to do. And my advice to you in that thread is to just print that sucker out and take it to your cardiologist, and you just accumulate the data exactly like it states there in that order, and you tabulate it. So I've caught some crap from pilots in supercub.org in the past saying, oh, this is overkill, but there's times, you guys, I'll show you. I got records today from a patient like this, This sucker is full of their medical records. Or sometimes I get a chart that's this thick, that everything's been tabulated. Okay, so here you are, some poor sucker in a cubicle at Oklahoma City, FAA, and you get that thick stack of records, or you get a nicely tabulated thing that has in there your blood work, your hospitalization records, blah, blah, blah. Which one are you going to expedite? You're going to pick up the one that is going to be the easiest for you to do. And if you organize it that way and you submit it that way to your regional flight surgeon, you have a much quicker turnaround time on that, and I can understand why. But just go to that thread, the stent thread on supercub.org. It specifically tells you exactly what you need to do, and you submit that to the FAA. after you've looked it over and shared it with your AME to say, do you think everything looks okay here? And the answer to that 99% of the time is it looks fine. Submit it to FAA. They're going to issue the medical certificate without any issue in the special issuance. And then you can turn right around and do your basic med again. Then you're good for 4 years. And if you never have another cardiac stent placed in, you're golden. But if you do, you got to go back to do your same thing again.
Very good.
Okay.
Randy, are there any questions you want to answer that nobody asked that usually come up? I think they hit the big ones.
I think I did too.
Yep.
Yep, I do too. Those are good. Those are all really good questions.
Well, I sure appreciate it. Hey, I want to do one quick thing. I'm going to unspotlight Randy's video, and I'm going to spotlight this guy. This guy, Alexander Rabinovich, is now on the spotlight. Dude, you have the coolest hat, and every week you sit there in the sun smoking a cigar and looking cool. And I just want to say thanks for being here, and you get the award for being the coolest guy.
Nice.
So,
awesome. Good.
How do I fix that? There we go. Anyway, Randy, thank you again for your time this evening.
You're welcome.
And appreciate you doing it. And if you ever want to give us an update later, we'll be ready for it again.
Okay, that's the deal.
Thanks,
Good night,
everybody.
you guys.
And we'll see you next week for Steve Pierce. That'll be a good one.
Sounds good.
All right, take care.
Good night.